Dr. Seth Tele Hassan, a gynecologist, or sanso a obstetrician, into Ukaboma, or a obstetrician gynecologist. Wabe cancer on a betching como. Doc, no matter about you media so.
Senior, good morning. Me that say waiting me a friend, my mama behind there.
Yeah. Doc, community bebre na ma bebre na per numbers ama boy dear. Onim say ma bebre e at risk. Na ye ka fibroid yeah. Fibroid na dey.
Okay. Fibroid ankasa no unse nipedua no ye wo different parts. You be can say ye wo muscle, ye wo fats, ye wo different bone near de. Ni na ye normal tissue. You be can say normal tissue because you expect to say me so mensa say minim say skin ne kata ni ye wo muscle as ye bone nso wom. But awodie no nso sa uterus no nso sa dodo na ye be can say a muscle ene wo ho. But sometimes no inyema bi timi si ema instead of sa normal muscle tissue no ye will be wo ho a ye be friend say more of a fibrous nature eni say wo awodie nim but inyema bi timi trigger sa de no na afei enyini e be say asedwoa a eda awodie nim nti e wo awodie nim
Okay.
dodo na e wo awodie nim nti ayedwoa sa no e betimi enyini e betimi aye kese pa e binim timi ye kese pa ma wo hwe kra ye mbe hye wo begense bia ka ma me ne nyem e bia full term 9 months ne fuka kraka but still any na betimi aye fibroid
Na ye ka fibroid mpanyufo aye research akache say age range no na 18 to 30 na anase ebia from first period. Ye fan say who am potting na fibroid to meet you.
Good question. I'll be saying very important. In fact, in Shishemu na omu ye baako bi in Ghana fairly recently. And no crowd omu breaking it down. It is all share ma between that we started to work as an can be over some age be start to be on men's up to 50.
Yeah.
And no son you be friend say reproductive age or more betimi afa for any saying.
Okay.
In Ghana, what they can say yeah share nipa every 18 years ekopem 45 because every 45 ekono men's menopause betimi esi to the enka 18 ye twa so kra but yes se sha yetimi hu say between the ages of 20 and 30 out of every 20 women baako be fibroid but interestingly between 30 40 ekono na afia be 1 out of 10.
Okay.
But if it do from 40 echo 50 no it can come to sometimes even up to 1 out of 3. And what it tells you is say just like you said you are right. Unyini kono the chances say obenya fibroid e was so kakra. But before we even get into anything, I mean state say fibroid e no nkyere say problem wo and you bia na wo fibroid problem.
Okay, very well. So you be do ho.
Very good.
But doc, fibroid here you can wan say me. Dear na to me ma obinya fibroid.
Okay. No cry woman say scientists abrofonia de yina ye nhwemu ahwe say ye di ensa besi bibi cross say ebia we na cause kama malaria betimi aka say ebia malaria parasite mosquito aka malaria fibroid ye nhede nimu pisa but ye hu say enema bi wo kwa ye di susu hwan etimi hu say we wo hwa the chances say obenya fibroid ye kese say na usikan ye bi before no for unfortunately what they ye to abrofo that's the whites your chances of getting fibroid was through different research or sometimes up to 2.5 times.
Yeah.
And na oba onwoda. And also so one of the things that me started. Onwoda. Yes. Intina sometimes no be hu e bia be shama maybe when you be 30, 35, 40 na or fibroid but still on way. Ni na aka ho. Ade baako so a omo hwehwe mo hu nse omo ta di beef and red meat. Ade baako e betimi de sa de naba. Senior also can you are right. Ebia say unsen at first no ye ma me no bi so mo a dodo na beka so almost started say omo chima omo nya o menses at the age of about 15 eko but nan say no ba form eno no brofo ye kan menarchy age a obenya o menses no nti early omo a be starting tem no the chances say obenya fibroid was ro kakra saying omo a be starting late because your hormones bi wo ho estrogen and progesterone ni nyina na ema oba etimi chima month bia but se etwaso na ye dwuma sa month bia wabra nyinsem bia ambemu a ebetimi increase chances no say fibroid no beba nema pi man so omo hypertension BP and also ka ho ebia so so na ebia wo family history ebia wo maame ana wo nua baa bi wo bi ena omo no nsa alcohol nso so timi ma ne basa ena stress nti enema nkitinkiti bi a ye hwe ye de ni na keka ho etimi se maame we the chances obenya fibroid e was low.
Obi send me a question or say over irregular flow of menses to me it cause fibroid and
oh and no dear enye no correct dodo na no so fibroid and ye be ne say fibroid ni mo be ma o menses no aba bebre enye say bi a emba sa dodo na sa na eye de ba ana say bi a wenya o menses ene no e be di 2 weeks na moja na stand babium enye normal I will say actually so once a month on average.
Now doc fibroid here you can asem no. What does it look like? It is saying okay. You say now describe it say better me ama we for ekesi say unyem no. Formation how does it get formed? Ma who says that tumor na ekesi
okay.
It me look at the pregnancy no.
Okay, say na me kan no so fibroid as a joa ebe start if kiti ano no as the pin eti no but ebe do time kakra no bo say na afi eye kese more sa ebe timi aye kese akoye em say case ba ko bia me na ne kese be 5 kilograms em say bia no na wo picture no so no aha enti ne kese no ebe timi aye kese sa obe hwe ma me no be say bia say na me kan e bia onyem no kura beka say akola we di oso but na be fibroid ebetimi aye say ba ko penedem ebetimi aba ne say more than one e bia 2 3 4 em say the most I may in one case e be 41
one case
ye 41
na kese 41 na nkiti
oh ye de kese ne nkitwa nyina ka say ye wi a ye be kan ni nyina to make sure say ye nya ni nyina nti ye kan ni nyina ye 41
na fibroid asem ya ye kan look DNA effects and side effects of having fibroids wawudie no na obi say nkofo say mbisa say does it cause infertility and I say you can still be pregnant and still have a fibroid.
Okay. Side effects, we start free side effects. No. Side effects no dodo na no. Ubehu say ebi amame bi wo hɔ a ne menses afi ebeba bebre ebi no or ne menses a edi be 3 days and 4 days na etwa eno ne normal baby do some points bi no na afi eba 7 days 10 days etwa so more than normal into be bleedy pa na ka ma ebi a ne menses no beba no da bia under normal circumstances ebi you pad be mienu ana miensa afi no you be 7 and ebi no mo hokra o muntimi use sanitary pad no just say bia baby diaper no mo dia ye no chere say wo bleed more into fibroid no bitimi ma wo bleed more o menses na beba normal kra be bleed more na afi eyi clots bebre so your menses so instead say fibroid no so da wo die nim no so menses no benya yaw more than normal and also so ya de ba ko ebitimi bleed kra ma afi onya anemia na wa paper white and no say anhwa anso ano a ebitimi kra ma omo afem ewu. Now, say eba fertility say obetimi nyinsan enokre eto da fibroid etimi si awo kwan. But no it depend on fibroid ne kese ene baby esi wa wo de nem. Ena ebi so wo so a fibroid ne nso saa o but ebetimi release neme bi a ebema the chance say obetimi nyinsan akọ but eno nkyere say wo fibroid a wontimi nyinsan minima bebre o more fibroid o nyinsan. The only thing ne say say wo fibroid enkan ne so a nyinsan ninti no fibroid no betimi aye kese mo eye kese mo a intimi nya moja if say say no ebe compete ni baby no ebe compete afa moja na eba awode no ho inti ebedu baby na fibroid ni nya moja ni na start say e degenerate oti abeje say when e bubu ene ya asempa
okay
enti sa because e degenerate na cells na what fibroid ewu na release niema ebe ma wate ya more inti madam for bi no time bia onyema enye easy ye genital hospital about 4 or 5 times because ebetimi du brebia say ye go to hospital ye di nsuo si wo so na ye sign ma withdraw nro ama eya no beba form nti ebetimi esi awo kwan benye time bia but so wo bi na se nyinsen wo ho a ebetimi cause problem
nti etumi wo nyinsen ye fa ne se wo nyinsen na fibroid no so e compete sana etumi terminate pregnancy no and etumi ha akola no
it me esa enkanka nyinsen na hyase no ebetimi ebia baby anka nyinsen na se ekoda wa odi anim na ebe okoda fibroid ne so ana ne nchen eno saa no nti nyinsen ne ntimi nyini papa ebe hu ana asa nti dodo na no ma binum a mo fibroid no be hu se o nyinsen ebedu kakra na asai o na asai but ebia saa symptoms na make can say ne menses beba bebre ebia no de onya bi but ono ne de no
but doc say na what can no I just say fibroid no were different types any baby atumi si ewo awudie no obatumi take you through eno bi
okay eno kre dodo na no ye were 3 main places ebia awudie nim no fibroid no betimi awo ye were 3 types your bako your friend is subserosal your bako your friend is intramural and the last one so your friend is submucosal now say ye hwe awudie no mu awudie no na bonten fibroid de besi ho no eno ne ye be friend say subserosal ye wo ne be wo awudie no maso ni mfimfin bisa eno ne ye friend intramural and the last one is submucosal eno de wo awudie nim wo unse awudie no enye say ye solid bisa ekwan dem inti ekwan na wo inside no wo eno ase pe ne wo eno ase pe no submucosal dodo na eno neta ha adwen because eno ne be ma moja etu bebre eno so ne betimi dodo na senyinsen eto so a e ma ne nyini
okay
sa intramural no se ye kese bebre a eno etimi act say sa submucosal no na eno so the problems about subserosal no dodo na no enta massa problems we but kai say enye awode no uterus nim kwa na ewo nipeduanim bladder no a ejunso twa no ewo awode nanim enti se subserosal no se eye kese na ewo ho a etimi ekamia bladder no enti kakra na maame na ejunso de no ana obejunso awie no enche na ne se still a opese ojunso ana se intestines nso wo ho enti se sa subserosal no so eye kese a etimi maame no enya constipation da bia na ne yemi etim enti se oba hospital na ye bisa fibroid ho nsema ye bibisa questions say obeje say oh moja na etumi na lenti na obisa sa question no ma ni nyina ho hia enne be ma ye hu fibroid be bia da jujuma edi na ehu ne betimi aye ede aboa
symptoms ni there as a wa kepi wa boboso but mete ho me oba me feel me was some of these symptoms but as a me sheden hu me nim say fibroid. How would I know say me wo hoyi fibroid wo me mo
okay dodo na no senem si kind symptoms na nyamaka no ebia na moja betu mo o menses no and as a time enso ye kra se obe o menses na afi moja etu eno so wo ho but dodo na ebi no so etoda na otese bibi ni namoyem ase bibi da woyem bi sa no aha dodo na ebi no timi complain sa but at the end of the day no matter what oba bia wo na onim se na onipa dua ne sitie so wo hwe na se bibi enhyira nkoyi a na esa wo ye ne se obeba hospital na oma gynecologist show dodo na betwa scan ni ahwese bia fibroid da wo de no na se ebia na bibi foforo kra na wo ho but me my unse yen bibi for na dodo na no yen time this problem ne just ebia etimi upa ansa na waba hospital any say yes sir enkanka ma no because the fibroid no eda ho cha etimi create so many problems send me see kind picture na mo share ma me no ani de 5 kilograms no the fibroid no eda awudenim for years and years dodo na kakra no na hu kakra osuro na dodo na so ye ka say oh eni ehu enye tan we de enye hwe saa obehu na koye bibi foforo enti eno health seeking behavior say ba hospital ente bo de ka bakra na ye ka say enye hwe no ye since ebia ehu na bibi saa ne enti no obeka say ma hospital
yen to aso na yen hwe fibroid na nkasa obi wo fibroid a life threatening development won the mu ana say obi babisa say fibroid no etumi dane cancer etumi be harmful emani banana
okay fibroid na nkasa na so hwa eno nkasa entanye life threatening
okay
but ninsunsanso no ebia se moja no betu ma afei ebekwa bibi foforo no eno na betimi life threatening mehu bida maame bi oba hospital na moja etu no ene catching so mehu gynecologist wa ma pa hwi na minim ne okoye unfortunately ahomachi bi na me wo hospital me night me be kofie no mde ne buy unfortunately na ma me no waka baby na nsema e fita white ni moja nyina sa wobetimi body ne se na nipedua ne sitie no se wo lose moja kakra betimi be handle kakra be kan say compensation be compensate kakra but ebedu some point we body na nkasa ejin se me no ano no aha inti that's one thing betimi are life threatening but se back cancer ne dia dodo na no enda ne cancer be 0.1% bisa in a betimi eye cancer be entire cancer but senesi e grow no e betimi ama side effects na per inti even though entire life threatening still e betimi how pa.
Oh dear, happy 98.9 FM. Oh share our ETV Ghana. Jumedi no air the happy morning show. And I pay there your focus on female reproductive system, any more health issues to me how more as they grow. Na many obstetrician gynecologist Dr. Seth Hassan, or up to speed with all we need to know about fibroid. Into anopedia education, gusua ekoso den fibroid no enya dia life threatening as Dr. Nedika Akanono. But other factors to me man ebeyehu say want to me anya attention in terms of. But doc, medi 18 now me starting me menses sana. Now you find say yes, 20-25 there about more fibroid. How long can I live with it?
Okay. So let me do kind the fact say what fibroid and stress when your problem. E bi no betimi our fibroid da odi nim e bia obenyin sen ansa na ebeka den say oh ye twa baby ni scan ahwe na ehun say what fibroid ho how dodo na sanete but it depend ye nim se na ebetimi grow ebetimi aba ne say ebe wo ho ketekete saa then all of a sudden na afi asate say ye kese nti ebetimi awo ho for quite a long time. It depends on one kasa the name be a beka unse risk factors na meka no e bia sometimes the risk factors ne bi beka ho a ebetimi trigger sa problem no
Yamba treatment fibroid no yet to me twice here.
Okay, treatment dey who here before I can treatment but your main can send back or else me be fi answer na member program we no my colleagues e bi e ka kire me say me ba me kan kire Ghana man nyina say eduro bi ani hɔ a wonum a ebema fibroid na nane almost remu pi me ma mo nyesa because ebia eduton for mo ka ni mi ade oh we eduro we be nane fibroid ni ade senior enye no credit da time bia me catch me patient say anka say eduro ni bi wo ha ka medwuma mi ye ka me jai na makoton say eduro no ka me nya sika kra more kra because fibroid anka sa no say ye hu say fibroid na how the only thing I betimi ra e dey to as e surgery say ye be yi fibroid no ana say ye be yi fibroid na awode na edam nyina ye betimi ama wonro a ebe ma saa mojetuo no ebe ba fom ana say ebia na wenya anemic say ma wedru ebe ma moja na basro enuro bi kra wo hɔ a ebetimi ama moja na twa for a while but as long as fibroid no wo hɔ die it's just a matter of time ebe san ba biom enti eduro bi ani hɔ a ewo Ghana ana ewo wiasim ba bia ebe na ne fibroid no eduro bi ani hɔ mesrew so obi ka say eduro no wo hɔ a on be hwehwɛ me no on kan kyerɛ me no on kyerɛ me na me ne nye me enko into partnership ne starting turning in this guy
Enti insema ye ka say to say Fati was show no so she just left or some members say enti eduro bi wo hɔ a na ebetumi a melty fibroid no and we ya no or say eduro bi wo hɔ a etumi fibroid na say ti na ebetofo no wan say we hu say fibroid ni die say bibia ni hɔ sa.
Okay, mami explain that nia ebete no mami explain bibi kakra. Say mo be kai picture na e kire fibroid ni bebra ba kun bi wo hɔ a ye friend of pedunculated. Eno no e fibroid a e wo awode nim. Ebi so wo hɔ a ebi e wo awode na no ba esensen hɔ. Eno sa no say eno sa no say yetimi chim no ema eno ateto ana say bibi timi se ema eno te eno ye special one ne wo a wo de ni man kasa no eno no ene betimi ayesa but ne aka ne de forget it enti da enti menyesa
enti abano management of fibroid procedures be ana processes be na obi wo fibroid mo betumi de na fema obetumi enya hoto.
Okay, So the first thing they say, we call hospital, of course. No, I call doctor. You know, be doing common. I have a fibroid no. As I say, if you make sure says a fibroid no, a problem because do don't know. Ebia send him zikan. Oh, koye bibi fufro. No way just scan your cancer or fibroid. Call doctor. The fact that fibroid keke inch say, I'll say. Ye hu bibi ebia na wo de wo fibroid be moja bi entu oyam bia nya wo ya o menses e ba normal all these things bibi eni ho a ye be bibi a friend watchful waiting ye be twen ahwe ebia every few months 6 months or so bibi sa na ye twa scan ahwe say ade na e kese ana say problem bi wo ho a no problem but say hwe na say ebia moja etu more ana say wo ya o menses e ya wo ya pan bi kra enya menses time no kra still o benya ya because of that degeneration na make no and now say push on other organs and now say ebia ye hwehwe mu a ye hu zanyi nsem bia mba ye suspect say bia fibroid and ebi no also so a fibroid no say nem sikan betimi aye kese obu na ma no obi ebisa say busumi say na onye ni nyina ka ho all these reasons nti ye be catch say ne pese say operation
okay
dodo na no say ebia maame no opeso sign wo biom and I say the age are relatively younger. Ebia baby be a friend of myomectomy.
Okay.
And no dear ye be raw with the name fibroid near can be to mama. But ebia age I was stroke akra. Kai say me can say from the age of about 40 to 50 no. The incidence no cost that's about at some point about 1 out of 3 or 1 out of 4. So in those cases no ebia na wa wo mai at that point say audio no mfa nya hwe biom. And in that case no easier say ye be yi awode no ene fibroid no nyina bom
okay
ye yi a eno nkyere say ye yi a na che say what start menopause there be okay. Ovaries no ene release hormones dem ma bibia kama nti ovaries no ye beja ma okay. The only thing is that after sa operation no wunya menses biom eno nkwa ba no echi de fine safe ye bi da bia.
Apart from surgery obi wo ho a onem say ono so sikan person be under the knife. Other ways of dealing with fibroid
okay abrofo no wo different technologies on modern basro bako something to do with radiology bibisa but even in some of those cases no any case bia na betimi aye adwuma most of those cases maybe except fibroid near ketwa kokrowa bisa dodo na so what it does is say symptoms na unya no e be solve our symptoms or fibroid ne die e be da so awo ho and in those cases same as long as fibroid ne wo ho nkwan de e betimi asan ba biom ye wo nuro wo ho e betimi a shrink fibroid no but in no say no dodo na so e betimi ama we ra menopause muntem nti e ya ye ndan nye sa ye ma o say dro no kra na e wi na say e koye operation no kra timi ye den because say dro na e de ama no so options be wo ho but in most cases in some people ebi no na be bo mo ebi obi onye fit for surgery you betimi ama o say edro no betimi manage symptoms but the question is how long now betimi afa edro no
na fibroid no mutu asiesa ana mu ye surgery na mu yi a atomi babio
ani no correct say e ka say babio ma ebia very good example na me mind said that time I think the most I may be 41 no 41 no ebia kese e wo me be bibi say ebia case 5 football na bibi sa ketwa na e wo no be say ebia endu minsatia ketwa no kra say but sa ketwa no kese na is a football no once upon a time net in fact na smaller than that enti say yes am myomectomy ye yi kese na say yi ketwa no so kan because ketwa na ye nyine ne no e chena be kese enti in most cases your statistics be within about 5 years after myomectomy 50% of patients almost sign fibroid nibium sign back but as to whether a be bakra no a be problem and also another issue so ni na so e ka ho
yamba back to fibroid and fertility obi wo fibroid na onyim at the same time ebano awo nipa no how do you your delivery obe go through normal delivery process na say because of fibroid and the challenges I say under the knife no mo yen say
very good and also here one other very good question and no it depended because one of the main things that depended send a saying now so far ebia maame no saa degeneration na meka no wenya bebree ama yagena to ho ma ne bibia ebia sometimes ebetimi abɔ mo yare pa eno ye one of the reasons ebia ebeka say maame we yenye operation ana say fibroid no se time ebe so say maame no be wo a fibroid no ye wo awode no ye wo ne soro ne ye wo ne form se fibroid no wo awode no form a se akola ni ti sane se ka se maame no wo na akola ni ti sane a ebetimi a block saa ekwan no. So in that case, no, what we do is say because say we dey say your operation. But and also so the size of the fibroid doesn't matter. The fibroid no any form honey was sro na say and soon be aside. Betimi a try ama mama no awo. But in those cases no say mama no banon one ka say ni Mexico no ebia operation no be pa and also you betimi any di ho komo. So a case by case basis means me nka say time bia was say ye operation and now say you betimi ama now by a case by case basis but obetimi awo in some cases obetimi awo in some just say your operation
patient ba ho na ohun fibroid and this patient no history of not being able to give birth. I don't know what do you take that patient to?
Okay, so say patient bana say onyin say ho problems ebia enema mienu either say ontimi mfefru and say ofefra na say no the fact say ontimi mfefru ana ofefru na say na say fibroid no eno nkyere say fibroid na causes ade no until we don't zoom in and cause only fibroid na debi ye be ye nhwemu ni nyina say problem fufuro bi wo ho ye be solve no na afi ya manekwan ya solve that problem na we na manekwan ahwe say obetimi nyinsan ya say ye hwe na say still emba na che say anhwa fibroid na causes ana say ya ye nhwemu nyina ewie no problem bi ni ho fibroid no nkwan na say te ho eno no dodo na ye be ka say na yen operation yen fibroid no na afi ya ma time na what try say obenyinsan
Fibroid hunkomo na yedi ewo dwumedie no so ye ko break na ba maybe phone lines no na mo ankasa so no mo consents mo wono mo de bebre na me make sure say one kasa e bia question bi wo ho a me bisa doc no obenya akonya say obefre na one kasa wo de sa question no ama doc na we yi no ama doc ye hwe fibroid any ne ho dwuma is it expensive?
So kind of expensive are then now.
You can say cost no a turn off amount of more fibroids and even when it's bothering them, even when a challenge more and ya dear to me call doctor say on board.
Personally, I don't think so. Maybe who say so much of a cost because there are other surgeries bibria and they all can say a cost that you bet me aka. But kai say baby obey operation so eka ho. Baby we wo ho a obetimi nya no e wo form kakra obetimi handle. Baby so wo ho a e wo soro but and also depending on baby awoko. And kai say nipa kro na obey surgery no hospital now obey surgery no nema omde be surgery no all those things are inside the cost into no dear so it's a ocean na say a problem who say a problem na ubetimi nya baby a be operation ama enye sika no enhye na nya problems I mean can say
okay na ban treatment na nkasa obi koye fibroid surgery say the recovery time no be say how long?
Okay, and no dear it depending on nipa chrono it depending on surgeon or be case no doctor no surgeon so be because me dear semi operation ma e ka me nka within the first 24 hours I say oh sorry now nante aha because wo deda ho no wonyare fine pain wo ho say ya operation ewie ye be ma withdraw be ma pain na brass but also say wonya ho nte ase say wo be sorry akeka ho kakra because that is also important be ma ekro na wuntem na afei instructions e be ma say na obesi ahwe wo ho no ubedi ni na so those are very important parts and no so this one recovery and shedanye densa obia but then again obia is different ebinu mo ho a ebetimi take up to 6 weeks and sana ombetimi akeka omo ho yie but in most cases ejina nipa chrono any operation mo nsem sometimes complications to me ba ebia na moja betu ni bebre ana say obetimi nya surgical site infection after ni nyina eka recovery time no but it depends.
Motumi fibroid any baby at the same time?
Oh yes. Yes, yetimi yen time yes sir because ebia maame no fibroid nti ya can say be operation a baby no. A baby no because of fibroid no. Ade ba ko a wo ho ne say ansa na you be can say the on pregnant uterus oba onyem uterus ne kese e be say ebia maka mensa abo ho say netie. That is roughly anywhere from ebi make us about 100 grams. But say time so say obe baby 9 months uterus ne kese e be say and the uterus alone it weigh about 1 kilogram.
Okay.
Apart from that, and so the amount of blood that by uterus now, the pregnant state getting to the end, be matiswa sachet of water per minute. That's volume of blood in our body no. And I say per minute. And I say the whole body no. By the time I'm no, it's sachets of water be 14. So if every minute one na ekọ ho what it tells you ni say moja na ekọ awode no ho edoso. Yeah myomectomy ni so baby a yebetwa no moja betimi aba ho. Moja ba ho more essence say e bia ye hysterectomy ni say yebeyi awode no ne fibroid ni nyina.
Okay.
Enti myomectomy ni moja betimi etu more. So say you can say ye eno aka ho whilst ye baby na there's a greater risk say moja betimi etu. So eno ye susu ehwe.
Okay.
In some cases ni betimi yi ni ebia baby a betwa baby no ebia na ehwa na fibroid ni da and there no problem.
Okay.
But to that baby a fibroid ni da ni ade no you can say ye go di fibroid ni chi a anhwa na ye nsesi form. Intenye time bia na ebe yetimi yesa.
Dr. Seth Hassan, a obstetrician gynecologist, ono ena ene twitwe nkomo efa fibroid ho na wacheche nema bebre efa fibroid ho yebedane ho kakra when we return maybe phone lines no na moso mo afre na mo ne doctor abo nkomo because we dey man komo be ma no ene dey esemu nya botwe na ma no ane doc edi nkomo enti yebedane ho kakra when we return I'll open the phone lines for you to ask doctor your questions on fibroid and minim say he'll do justice to more questions. We'll go for a short break. When we return, the Happy Morning Show continues. Welcome back from the break. We are live on Happy 98.9 FM. We're also live on ETV Ghana. This is Ghana's #1 morning show, the Happy Morning Show. And a health topic I discuss fibroids. Dr. Seth Hassan, or a obstetrician gynecologist, or a expert, or a specialist on me edin komo efa fibroid ho na community shall say at around 8 o'clock. You're sure say if you just tuned in no and we may say out but my mama akunya say mo doc e betwitwe komo maybe a phone line so for about 10 minutes and be beside doc more questions. But doc, before me call me questions no maybe a phone line some callers no. What can I do to manage the situation and I said to possibly prevent myself from getting fibroid or minya, how can I manage it in a way and to mean that before?
Okay. That's a very good question. Adebako so it's me cause a fibroid. One thing, obesity. Anything that you can do to reduce weight, no, it can really help. So diet control, exercise, and also are very important. We can say beef, red meat, and so there's some link. And also say it's so do more fruits, vegetables, and also important. There are some others and like your family history, genetics. What do you mean? That one it doesn't really work. But and then with hypertension also make sure cell manage. In fact, don't even get it in the first place. Exercise, diet, those things can help. But anyway, if it comes, it can still be managed.
Okay. Obet me afre 0244-885140 0244-885140 and 0555-65-7278 0555-65-7278 Obet bisa doctor question bia ope fibroid no would any baby out very free
Ray, good morning.
Good morning.
Ray, I disagree on you say we Emma one of these kind of mom call hospital.
Yo, and then pacho doctor
Adam from Tribune.
Yo,
Ray, Emma don't wanna go watch because some of them will fish out to fair. Yeah, na ebe from my
yo, pacho.
Me question me better me bisa in respect of you say. Fibroid no who you are who banu you are who there be doctor so who banu you are who to me na and as so fibroid ni piles almost be in common now.
Fibroid ni den.
Any
Pals. Okay.
Go.
Okay, yo.
Yeah.
Doc.
Okay, that's a good question. Fibroid and piles are two different things.
Okay.
Connection be any.
Okay.
And when it comes to time, I'll be to me fibroid. Bet me see any time be. The fact say, why would I not interest won't me fibroid? E be a crana fibroid no work that abanisa. And why we no e be a bit me I can or by your name said the more I'll be no it's me reduce it like risk so benya, but still a bit me see.
Okay. Would any baby out for you? Hello. Your name and where are you calling us from?
Please, I'm Dorothy. I'm calling from Ablekuma.
Okay.
Please, I want to know whether fibroid is it connected to umbilical hernia.
Okay. Doc.
Okay, Dorothy, there isn't really a link between a fibroid and an umbilical hernia. The umbilical hernia has to do with the abdominal wall, right? Just that. And then the fibroid is usually associated with the uterus. So there really isn't any significant link.
Would any baby out for you? Okay. I say me call no, me lose me call no. But Doc, Osha fibroid nankasa. A question menya consistently on my phone no any recurrence no. I say a lot of people are concerned about when you take it out if it would come again. We answered that, but I keep getting that question. Hello caller, would you need baby out for free?
Happy FM.
Yeah, you're live on Happy FM.
Okay. If I call for fibroid will be but no I'm manu center.
Mpacho obet me a raise your voice kakra.
The bank is in
Oh, can you repeat your question, please?
Hello.
Yes, we can hear you. Can repeat your question.
Each time I may message, you know, not a bank is in Kitty. Message bank is in Kitty. And Manu, Roy. Let me be say, a Diana, Mayana, a better me about.
Okay. Doc.
Okay, dodo na no say fibroid na say fibroid no ebe hawa fa menses no ho a ma menses ne ba bebree enye normal say eso bete in most cases say yakata so fibroid na say apart from that nso when say menses no so atia there are so many things a bit me ma menses no so ate. What I think you should do, even say if you are moja wo from cry no cry bit me manate, even if you have a fibroid inti my advice is say who gynecologist among labs making sure I'm finding out what the problem is and wow answer.
Okay, Doc, and also answer back. If I have any more callers on the line now. Hello? Would you need baby out for you?
Hello.
Yes, hello. Would you need baby out for you?
But I'm a free away to Kwashima Adi Junction.
Okay.
Doc, but maybe say hello.
Yes, you.
But 2021. Me koye fibroid won.
Okay.
I may have fibroid no. From that moment no, that is an immense complicated abemo. Up till now. You say I'm person who medical doctor I said, what is the cause of it?
Okay, Doc.
Okay. Say operation ni wie na say unya problems with menses e bia na emba ye ana afedi eja dia a number of possibilities. Say fibroid no e can submucosal one ye wo inside na nkasa ho a sometimes no see ye a etimi ha sa inner layer no na sa inner layer nso so na wo ye menses no shede ana eno so e de moja ne ba so ebetimi atetare eno. If that is the case, esa ukohu doctor, esa usankohu gynecologist, no moshishim. That's one possibility. It could also be say ano menses number no bibi fufro. And I just so happens say we are operation we and no so be kan ho. In the so wo kono moshishim na figure out because mean to me just this little bit means me fine no and mild diagnosis. But these are some of the possibilities a bit me causes.
Hello caller, would you need baby out for free?
Hello.
Hello. What do you need
Me pato me di Christy.
Okay.
Me pato question na me busa ne say. Say why ye wie no. Ebia ye yi ni nyina afirim. Na why ye wie no me pato wo betumi ene be ma da na.
Okay. Doc. Yeah, doc it here. Yeah.
Okay, Christy say yeah operation fibroid operation na ye can say hysterectomy na ebe yi fibroid no ne awode ni na aka ho a. Definitely yes, so betimi ne be ma hia any problem. That's the hysterectomy. Hysterectomy ne kire say yi awode ne keke. Of course, ebe se oni be ma be hia ebe the time we heal bibia fine. Say yeah myomectomy no so a the most important thing is say we heal ansa na ebia only be measure because ebetimi ama when you have some problems with pain and infection and baby say we heal na only be measure.
Okay. But Christy, doctor, you question I know amao. Hello, caller, we didn't baby offer free.
Hello, Pacha me Agnes, you can see tema.
Agnes, doctor.
Can see tema.
Okay, doc wa.
The Pacha no calling a fibroid operation be almost 4 years in it. Na me no na bra me yer na me nya weight pa but me weight no correct. But a woman na me nya pain so much but bra na fibroid no na me nya something. But ko yi no pain na ko but a woman na ba me call hospital go bi no man ya group no man na ko. But a woman na abakakra but wo yi ma wo di ni na. It is because they wo yi with the national mo me nya problem bi. Na me fact me me nya problem bi ana. But me okay. But wo mama me group bi ana me no. But the medical do ni sa, the let me go to biomana because me no na me okay.
Okay, Agnes, ne wo hone say yayo say ne wo kan me to ase a wo say answer na ye koye operation na wo te yaw pa but omi operation we na yaw no koye but from time to time yaw na san ba say yaw na san ba ebetimi different things unim say maybe wo ho a so mo your menses are naturally obenya pain. Ebi so wo ho a 2 weeks before menses, that is when ovulation be no omote some pain kakra. And there are so many things ebetimi cause pain. Enti no matter what the cause of the pain, say amount pain medicine ebi apara na bibisa ebetimi ma pain nako but I say near cause pain no that's ho. So if anything at all no nipa kra ese okon ho doctor ese okon ho no ese otimi find out what the problem is na o treat sa problem no. Enti I think that's the best thing to do. Say ebia baby okon time bia obekono ma pain medicine. Number 1 bisa say doctor adena eya me no den ya no muntimi explaining chiro. Say when me nya sa muano what the best thing that you can do is say obeko hospital foforo na oni sa omo gynecologist so edi hu nkomo ebia no no so betimi aboa
Would any baby offer free? Hello. Your name and where you calling us from? Okay, my NTO, doc wa.
But like my family planning by me menses.
Okay.
It mean bisa say they na me ya ebe boam.
Okay, doc.
Okay, okay, answer na be family planning no. Near say and say I will say any undi nkomo counseling. But unfortunately no, me who say enye obi a nya sa counseling no. So ka say opese utwa opese unyinse ani ama we dro keke. It isn't right because in Rona yelebe no it depend your panie how be 1 month bia your panie how be 3 months bia your pills how be num de bia your pills are ebia when be mehia by mistake and which you betimi afa your ne de hye yensa your ne de hye a wo de contraception no your different types but the most important thing is ebi wo ho a ne dwuma na ye no ebe ma o menses na twa enye obi a na esa ebi so wo ho a menses na be ba kakra bi. So before you be mouse contraception, I will say you explaining in natural so that baby says here enya one. And minim the type lady no but it's possible say a normal effect of contraception. But say osheno antiasia baby omo man sa contraception on san ko no mbise mu no mo explaining chire say ebia sa type no and no be nebe cause sa.
Okay, doc. Hello, would you need baby free?
Pacha, somebody do me just a fit,
Abigail, my NTO, doc wa.
Pacha, somewhere last year, no, let me be for like 1 month and some days. Jimmy for hospital, I'm going to check up normal say. Menyamba, ectopic. But during the scan, it was later discovered that I'm also having ovarian cyst. So I'm supposed to go in for a surgery, but because of money issue, I took a transfer to a general hospital. Then I was told that I've lost the pregnancy, but the ovarian cyst is there, but it's not that that huge for me to go for operation. But my problem is in my family we have fibroid history, so I'm kind of confused whether it's two things or it's one thing. I don't know. And right now, this morning I'm really in pain. And when I complain to my mom, she's like, so I don't know whether it's my fibroid doing the thing or ovarian cyst doing the thing. So I just want to know.
Okay. Okay, Doc.
Okay, Abigail. Thank you for the question. I'm glad that somebody asked this particular question, even though I'm fibroid no, but it's very important. First of all, so we baby ne kasa ovarian cyst and no say necessarily say a problem or in fact, finding cyst in the ovary to some extent are normal. If the cyst is too big and now say near what cyst ni mono, it's be a blood and a bibisa a womb. Those I can say that and no Rebecca say there's a problem with the cyst because say ovary no cyst a womb a yekesia a bit me twisted and your friend a torsion. Okay. So twisted is a medical emergency. So I'm for one call theater a bit me pie and you can have all sorts of complications. It's very painful. It is a cyst no say it depends on the size. I believe that surgery on person surgery it was because it was big. Maybe over a time it has shrunk. I don't know. So that information would help. Now, the important thing is to find out if you have a fibroid or not. Yeah. If you have a fibroid, let us manage it. It's a fibroid in you where the cyst can also be managed depending on the size. That's the most important thing.
Very well, Doc. As a my final caller now, me release the Doc. I said Doc, koshe. Okay, as a callers nasa. But Doc, obisu sending me message here. As a opese obehu. Also opese obehu. And also anything.
Oh.
Omo pese omo hu me tie for na ahwefo omo pese omo hia Dr. Seth Hassan. How do they get in touch with him?
Okay. Me a specialist, me ejuma Ghana Hanom, me wo Mamobi General Hospital.
Okay.
So ba honoma, you just get a card. There's a general hospital. E beti me di unkomo.
Okay.
But say opese ohume on the side, maybe it's another conversation you want to have with. I can, if you don't mind, I can give my official telephone number and then call me on. So that is 0.
Set number there. Time I'll answer there.
Oh yeah. You see, so it's a good thing I work in. But if you call and I say, "When you mail, me send a message," and then I can reach out when I'm free, and then we'll see what to do. So the number is 050-465-9378. A official line, so it isn't always one that I have. 050-465-9378.
Okay.
So friend away in Yamia. Sometimes when I'm off work, I turn it off because me a human being.
Yeah.
But you can send a message. I'll definitely turn it back on and then we'll get back to you.
Dr. Seth Hassan. Say one name listeners and I'm sure for you've shared a lot of insights on fibroid with them. We appreciate your time and we appreciate your submissions and your thought-provoking advisor wama me viewers and actually for Doc Anope Adase.
Thank you very much, Ms. Medase.
We hope so we'll have you back in the studio again.
I'm at your service.
Major phone lines, Nanka, I'm sure say by now, we release you because a lot of people have concerns. But if you want to contact Doc, the number no atuja na ose o Mamobi General Hospital. Obahwa obetume Esiano na concerns be obiano obetume abuao senebeya obetume amanage. This is still the Happy Morning Show.